We are so excited to partner with you during your student experience. Here's just a little bit of information about Jackson to set you up for success and give you a better understanding of who we are. We are a not-for-profit organization committed to improving the health of all members of our community by providing superior, patient-centered, and cost-effective care in a safe, compassionate environment. The vision of Jackson Hospital is to be Central Alabama's first choice for health care. Our values as an organization is compassion, diversity, education, innovation, integrity, quality, safety, and teamwork. This is just a few things we're going to talk about today. It's going to be our framework for communication, emergency numbers and codes, exposures to hazards, infection control, and safety measures. First is AIDIT. This is our framework for communication. AIDIT is designed to keep patients informed and make them feel heard. With AIDIT, we acknowledge the patient, greet them by name, and acknowledge the family or friends in the room. We introduce ourselves and tell the patient, tell the family who we are and our skill set and professional certifications. 2 expectations we want to give patients when we enter the room that's going to help them feel secure is going to be an expectation of a duration and an expectation of what they should expect next. Explaining step by step what they can expect you to do, answering questions, different things like that. Before we leave a room, we want to thank the patient, thank them for choosing Jackson, for their communication, and for their cooperation. One of the values I touched on is as Jackson, is our goal is to always be compassionate to patients. We never know what a patient's going through or what even the family of the patient has gone through, and it's really easy to look at patients and forget that they are individuals who have a life story and that they're not just a job or a task that we need to complete. So making sure that we address each patient not only with our words, but with our body language, and having our body language represent the empathy that we feel towards them will always speak louder. Another value of Jackson is diversity. Healthcare providers must have sensitivity and ability to recognize and appreciate the characteristics of all clients and patients. A couple tools that we have for cultural diversity. The first is going to be Stratus. This is a translation service for non-English speaking patients on our portable computers. We also have ASL interpreters that can be scheduled for patients who need them. So the first 2 emergency numbers that I want to give you is going to be security in the courtesy van. That number is 8007. And then anytime you need to call a code or you need to call for an ICE team assessment, that is going to be 8222. Emergency codes you may hear overhead are going to be code 33. This could be a watch or a warning. Code 1, bomb threat. Code 66, mass casualty or disaster. Code ICE team. This is going to be called for a patient that is deteriorating. This will be called on your non-ICU floors. This code will not be called in the ED either. This notifies the nurses that are assigned to the ICE team for that day, which is going to be 2 critical care nurses and a house supervisor. This notifies them to respond. Code 99 is actual or impending cardiopulmonary arrest. Code Silver is an unruly person with a weapon. Security will respond. And observers and students, please stay away from those areas. And I want to go back just a minute to the code 99. I don't know if it's going to let me actually go back, but anybody with the BLS certification can do chest compressions, so keep that in mind. A STEMI alert. This is recognizing the signs and symptoms of a STEMI. You could hear this when a patient comes in through the ED, or if you have a patient on the floor that begins to show signs of a heart attack, you will call an ICE team, and then the ICE team, upon assessment, will call for a STEMI code. Code 44 is a code rupture. Code 77 is a code walker. It's important to be able to describe the person, age, sex, clothes, and indicate where they came from. Code 88 is a stroke alert. You may also hear code 88 with T and K, and this notifies the team to prepare for T and K administration because the patient's last known well time was less than 4.5 hours ago. Similar to a code STEMI and a code rupture, if the patient is already admitted onto the floor, an ICE team will be called first, and then the ICE team can then call a code 88. Code 3 is an unmanageable person. This will alert security. I want observers and students to avoid the area of this code. Code Pink is an infant abduction. Your responsibility during this is to find an exit and to manage. Nobody leaves, nobody enters. Code Crimson notifies of a mass blood transfusion. All these emergency codes are crucial to allowing the facility to have emergency preparedness and for more effectiveness in responding to emergency situations. May face in a healthcare facility is being exposed to bloodborne pathogens, and equipment has developed so much in the last few decades of just being able to protect us more from these bloodborne pathogens, but we all still have a responsibility in protecting ourselves. And the first thing you can do is just simply pay attention. The amount of needle sticks I see just because we were simply not paying attention is way too many. Another huge thing is utilizing sharps containers. Always placing your needle in a sharps container, notifying your charge nurse, someone, if a sharps container is greater than 2/3 full, and do not place a needle in that sharp container if it is too full. There are multiple sharps containers going to be available in every unit, so make sure you alert a sharps container you can dispose of the needle in. So what can you do to prevent infections? Of course, hand hygiene is going to be number one, following universal precautions, and report any communicable disease you develop to your clinical instructor. Hand hygiene is number one, like we said, to preventing infection. So when can you use hand sanitizers? When hands are not visibly soiled, before and after patient contact, after contact with objects in a patient's room, before putting on gloves, and after removing gloves. You will notice in the healthcare facility you will have certain patients on isolations, and patient isolation is used in hospitals to prevent the spread of infectious disease between patients and visitors and staff and visitors. So you want to make sure you follow the PPE requirements on the sign. One thing to know for student nurses, students will not be allowed in any suspected or confirmed tuberculosis, COVID-19, and airborne or droplet precaution rooms. This is just strictly for the student's safety. PPE protects patient, protects you, protects your loved ones. Universal precautions is the #1 approach to infection control, and this is universal precautions you're going to use for treatment of all human blood and certain human body fluids, and that just means that you're going to treat that blood, treat certain human body fluids as if they were known to be infectious with a bloodborne pathogen. Airborne precaution is, like I said, students, not a room you're going to enter, but it's important for you to know that, this could be tuberculosis, measles, chickenpox, and so entering these rooms will require an N95 respirator. The door has to remain closed at all times. Contact precaution is going to be used for patients with known or suspected infections that represent an increased risk for contact transmission. So you want to wear gloves, gown, disposable patient equipment in these rooms. Droplet precautions are going to be known for suspected or known infections in patients that are transmitted by respiratory droplets. So these patients are not required to wear N95. When you enter these rooms, we are not required to wear N95, but we are required to wear a mask. The door also should remain closed for these rooms. Is going to be required for the main thing you're going to see is C. diff, and gloves and gowns are required for this room, as well as dedicated or single-use patient equipment. This is also rooms that require hand washing when you leave versus hand sanitizer, and also to clean equipment coming out of this room requires bleach. Neutropenic precautions is a reverse isolation that is designed to protect the patient. So this is a little bit different. You always want to use hand hygiene. We want to make sure that none of the visitors are, demonstrating signs of illness. No dried, fresh flowers, potted plants, or fresh fruit. Visitors and staff need to wear gloves, gowns, and masks. And the patient needs to wear a mask when they leave the room. Modified respiratory is used for patients that are suspected or lab-confirmed COVID-19 for isolation. This requires gloves, gown, N95, goggles, or face shield. This door must be kept closed. So we want to, of course, protect you from being exposed to any of these hazards or being injured. But if it happens and you are exposed and you are injured, with needle sticks, you want to immediately wash with soap and water. If your exposure is nose, mouth, or skin, you want to flush and splash with water. With your eyes, you're going to want to irrigate with clean water or saline. You need to report the incident to your instructor and to the floor charge nurse, and then you will be given steps to seek medical attention in the ED. Once you have been assessed in the ED, you will report back. An event report needs to be completed, and it needs to be completed completely and accurately with full details of the event. Patient information needs to be entered, and this is to protect you so that we can make sure we audit that patient's chart. And then when this information is entered correctly, it will allow our employee health nurses to order the correct follow-up testing and to contact the student or whoever was exposed when needed with information or to perform follow-up testing. Stop, think, and don't fall. There are some new fall interventions that you'll see coming out across the facility. Fall prevention is a very important part of patient safety. It is a responsibility of each of us to make sure our patients are safe. Number one is going to be the call don't fall signs that will be placed in the bathroom, and this is to help remind patients to call and also to remind families. Grippy sock magnets is a new fall risk intervention, and these are going to be for patients that fall in a yellow or red category fall risk assessment. The traffic lights are going to be placed on the whiteboards in the rooms, and this will display what category the patient falls in. So if the patient falls in a green category, then they are a walkie-talkie. If they fall in a yellow, then they need assistance. And if they fall in a red, then they are heavy assistance and they do not need to be left alone when ambulating. Hourly purposeful rounding is a key fall prevention strategy. And so that's toileting, assessing their toileting need, environment needs, movement needs, and pain needs. A key thing with environment is keeping the room free of clutter and light where the patient can see. Keep all personal items within reach, including that call light. We want to answer those call lights in a timely manner. Make sure the patients have non-skid socks on. Make sure the patients that need it have a bed alarm. If a patient is assisted up and they required a bed alarm before that assistance, and you assist them back to bed, please remember to set the bed alarm again. We want to utilize our assistive devices for ambulation, and bedside commodes is also something we can use to limit the distance that the patient has to walk. Fall risk assessment should be performed every shift or when a patient has a condition change. And fall risk armbands need to be placed on the high fall risk patients. The call don't fall signage and the grippy sock signage is really important for patient and family education, and also staff helping staff. If you don't have a full understanding of the patient, you can see that signage, even the traffic light signage, and know what the need of this patient is. You want to protect yourself when you are lifting things, when you are helping patients. Get help, use your legs, lift with your legs, keep your back straight, don't twist, and utilize assistive devices. Fire safety. We want to protect patients, visitors, and staff. The code you'll hear for a fire alert is going to be Mr. Red. It's important to know that oxygen, fuel, and heat is the triangle of fire. Remove any one of them, you don't have a fire. So report any unsafe conditions. Practice good housekeeping. Protect your electrical outlets. Keep anything that burns away from electrical outlets. Keep your workspaces and equipment clean, dry, and well ventilated. Learn and practice emergency procedures. Remember that code is Mr. Red. RACE. This is going to be your fire emergency response. Rescue, alarm, contain, extinguish. PASS is going to be how you utilize that extinguisher. You're going to pull the pin, aim at the base of fire, squeeze, and sweep. If the fire is in an area that is not yours, you want to close the doors, keep patients and visitors calm, prepare to respond if the fire or smoke threatens the area, and use stairs, not elevators. This is just a few things of some electrical safety tips. Like I said, if you see anything unsafe, please report it. These red plugins are really important for everyone to know. These are our emergency power outlets. So these outlets are connected to the generator. So anything plugged into these red electrical outlets will keep the equipment alive if we have a power outage. So any life support equipment needs to be connected to an emergency outlet. Radiation safety. Just be mindful. Radiation is used to diagnose, intervention, and therapeutic purposes. And radiation exposure can really add up when received by workers over a long course of employment. Some things that you need to be concerned with when it comes to radiation safety is x-ray machines, implants, nuclear medicine, cardiovascular imaging. The less time you can spend with radiation, the less radiation received. Create distance from the source of the radiation. And there is shielding, so you want to be behind shielding from the source. HIPAA, so important, especially as a student walking into a healthcare facility for the first time or newer to a healthcare facility in general. This protects patients' medical information. This reduces healthcare fraud and abuse. HIPAA sets the standard for healthcare information on billing and other processes. And HIPAA requires the protection and confidential handling of protected health information. Goes to patient medical information, it is very important for you to know what confidentiality is and that you practice confidentiality, guarding and limiting of any discussion regarding medical condition, diagnosis or treatment by staff, physician, or other members of the healthcare team. Information needs to be shared on a need-to-know basis. Well, thank you guys for your time. We look forward, like I said before, of having you in our facility, and please just let us know if we can do anything to help you or if you need anything.